So in this video, I'm going to talk about type 1 and type 2 diabetes. I'm going to explain the difference between the two types and how they are treated. So if you're a diabetic, it is important to understand this information so that you can get the best possible care. So now let us talk about type 1 diabetes. So although a person can get type 1 diabetes at any age, it usually happens before the age 30. A person's immune system destroys the pancreatic beta cells which produce the insulin. So this causes insulin deficiency. Without insulin, a person with type 1 diabetes cannot survive. However, due to medical advancements such as insulin pump therapy, different types of insulin, and continuous glucose monitoring, people with type 1 diabetes can actually have similar health to people without the condition. So that being said, it requires a lot of knowledge, discipline, and commitment to keep their blood sugars under control. Now let's talk about type 2 diabetes. The condition was first known as adult onset diabetes, but we are now seeing a high incidence of these conditions even in young people due to the rising pandemic of physical inactivity, sugar consumption, and processed food consumption, among other factors. The key problem here is insulin resistance, followed by inadequate compensatory insulin production to overcome the insulin resistance. So basically, there is a high level of insulin in your blood, but your body is not responding to it. It keeps asking for more insulin, but your pancreas is not able to produce it. So basically, when your insulin is not able to function properly, your blood sugar levels are going to rise and your doctor will diagnose you as a diabetic. So type 2 diabetes treatment is focused on reversing insulin resistance. So exercise and reversing the sedentary behavior can both treat insulin resistance. For example, let's say you have a sedentary job where you're sitting for more than 8 to 10 hours a day. You can help control your blood sugar by walking for 5 to 10 minutes every hour. When you combine this with regular exercise such as brisk walking for 30 minutes every day, you can bring your blood sugar back under control. So studies show that exercise can help reverse insulin resistance even without weight loss, but the key is it has to be done regularly. So this means that if you start doing what I mentioned right now, you'll start to see improvements in your health right away. You don't even have to wait months to see changes in your weight. Additionally, carbohydrates that are minimally processed and high in fiber such as brown rice, quinoa, bulgur wheat, lentils, fresh fruits and vegetables, they all can help keep your blood sugar under control, thereby reversing insulin resistance. So what about medications? So there are certain medications that can increase insulin sensitivity, which doctors can prescribe. There are also some medications that can boost insulin production to meet the demands of insulin resistance. I personally see medication as a supplement to lifestyle changes, and my focus during each and every visit is how I can reduce the pill burden. So it is a common misconception that people think that if you take insulin, then you're type 1 diabetic. If you don't take insulin, then you're type 2 diabetic. There are, however, some type 2 diabetics who still require insulin due to the high blood sugar levels. Our goal is to slowly reduce the insulin dosage through lifestyle modifications. I've had several patients have completely come off insulin after they made those lifestyle modifications. Again, we're just focusing on the type 2 diabetes here. So finally, complications. So diabetic complications come from high blood sugar and also high insulin levels. So high blood sugar complications are usually microvascular, such as diabetic retinopathy, diabetic neuropathy, and diabetic nephropathy. So recent studies are showing evidence that macrovascular complications are likely due to high insulin levels, which is directly linked to lifestyle like we talked about. Macrovascular complications include heart disease, peripheral vascular disease, stroke, etc. Hi guys, are you finding value in this video? If yes, please click the like button so that this video can reach more people. So patients with type 1 diabetes are acutely vulnerable to an acute complication called as diabetic ketoacidosis. Although this can happen in type 2 diabetes also, it is pretty rare. In the absence of insulin, the body starts producing ketone bodies for energy. These ketone bodies are acidic. When ketone bodies are produced in excess, they can cause acidosis. If left untreated, this can cause the body to shut down, resulting in death. Although this can happen in type 2 diabetes as well, it's still very rare. So the good news is that if you lead an active, healthy lifestyle, you can lead a healthy life no matter what type of diabetes you have. So that's why I created this channel to help you stay active and provide tips and exercises to recover from sports injuries, keep your diabetes under control, or even reverse it if you have type 2 diabetes. I have a number of videos posted in my YouTube channel to get you started with the exercise journey. So don't postpone, start exercising today, and I'll see you in my next video. Until then, goodbye.